Hello, guys! Welcome to the first Crash Course series, brought to you by Free Health School. Today we will be talking about asthma. By the end of this video, you'll have a solid understanding of the pathophysiology, symptoms, treatment, and interventions related to asthma. Let's get started. So what exactly is asthma? Well, it is a chronic inflammatory disease of the airways that causes episodes of wheezing, breathlessness, chest tightness, and coughing, particularly at night or early in the morning. These symptoms are associated with variable airflow obstruction, which is often reversible either spontaneously or with treatment. Now, let's talk about what happens in the body during an asthma attack. The key players in asthma are the airways, specifically the bronchi and bronchioles. In an asthma attack, three main events occur. Bronchoconstriction. The smooth muscles around the airways tighten, narrowing the airways. Inflammation. The lining of the airways becomes swollen and inflamed, further narrowing the airways. Increased mucus production. The airways produce extra mucus, which can clog the narrowed passages. These changes make it difficult for air to move in and out of the lungs, leading to the classic symptoms of asthma. Recognizing the symptoms of asthma is essential for early intervention. The common symptoms include wheezing, a high-pitched whistling sound during breathing, shortness of breath, difficulty breathing, especially during physical activity, chest tightness, a feeling of pressure or constriction in the chest, coughing, often worse at night or early morning, and may be the only symptom in some cases. It's important to note that asthma symptoms can vary in frequency and severity from person to person. You also need to understanding the triggers of asthma is key to preventing attacks. Common triggers include allergens such as pollen, dust mites, mold, and pet dander, respiratory infections like the common cold or flu, physical activity, particularly in cold or dry air pollutants, including smoke, strong odors, and chemical fumes, stress and emotions. Anxiety, stress, and strong emotions can also trigger asthma. Avoiding or managing these triggers is a critical aspect of asthma care. Diagnosing asthma typically involves a combination of medical history, physical examination, and lung function tests like spirometry. Once diagnosed, the treatment goals are to control symptoms, prevent attacks, and maintain normal lung function. The mainstay of asthma treatment includes inhaled corticosteroids to reduce inflammation, bronchodilators to relax the muscles around the airways, making it easier to breathe, leukotriene modifiers to block the action of chemicals that contribute to inflammation, allergy medications if asthma is allergy-induced. Patients with severe asthma may also require biologics or oral corticosteroids. As a healthcare professional, your role in managing asthma is crucial. Here are some key interventions. Assess respiratory status. Regularly check the patient's respiratory rate, oxygen saturation, and peak flow readings. Administer medications. Ensure the patient receives prescribed bronchodilators and anti-inflammatory drugs on time. Educate the patient. Teach the patient and their family about asthma triggers, proper inhaler technique, and the importance of medication adherence. Develop an action plan. Help the patient create a personalized asthma action plan, including steps to take during an exacerbation and when to seek emergency help. Monitor for side effects. Watch for potential side effects of medications, such as tachycardia with bronchodilators or oral thrush with inhaled corticosteroids. Effective care can make a significant difference in the lives of patients with asthma. To wrap up, asthma is a chronic respiratory condition that requires diligent management and care. As nurses, understanding the pathophysiology, recognizing symptoms, identifying triggers, and providing effective treatment and patient education are all vital components of asthma care. Remember, your role is not just to treat, but also to empower your patients to manage their condition effectively. Thank you for joining me today. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more nursing education content. If you have any questions or topics you'd like us to cover, leave a comment below. Until next time, keep learning and stay healthy.